Alright, so now we're going to talk about cleaning our instruments and our ET tube post-procedure. So take everything from the surgery suite, including your ET tube, and we're just going to come over to the sink. They do need to be cleaned and sterilized in a separate way. You cannot do them together. So I'm just going to take my ET tube for now and just put it in a bowl off to the side. With your instruments, you're going to want to make sure that they're all open and that nothing is locked so that everything can get nice and clean. We have our instrument detergent, so when you dilute this out, it's going to be 1/8 of an ounce to 2 ounces per gallon of water. So you're just going to squirt some of that in the tray, and again, make sure everything is open, and it can just kind of sit and soak for a while. If you have another procedure to do, or if you need to finish with recovery or paperwork, it can just kind of hang out and soak. So for the ET tube, we have our separate cleansing solution. It's dilute chlorhexidine, so it's 10 ounces per 1 gallon that we're going to use. And you're just going to squirt some of that in the bowl. Again, it needs to be done separately. They're different solutions. When you're cleaning your ET tube, make sure that you have your cuff inflated fully so that we can scrub everything out and make sure it's not stuck in any of the crevices. Let's scale this here. So inflate your cuff, again, just so that it's nice and tight and you don't have anything gross that gets trapped. So once it's inflated, and you have your solution in the bowl, you're just going to submerge it, and again, it can soak. We have our 2 separate cleaning tools that live under the sink here. So you're going to take your one and clean out the inside of the tube, just making sure to get any of the respiratory secretions and whatever else may be in there out. So do it on both sides, do it a couple times, make sure it's nice and clean. Once your inside is clean, take your other brush and scrub the outside really well. Again, just getting rid of any of these secretions and anything that might be on the tube. With these, you then rinse them off, and once it's rinsed, you can kind of wring it out a little bit, and then it just air dries. So you can hang it up and let it air dry, and it can go into the rack for storage once it's done. Back to our instruments. So they've been soaking for a while in our detergent. Once they have been soaked, you can take your brushes here and just making sure to get in the crevices and get rid of any blood and tissue that you might see. So go ahead and scrub them off. Once everything is nice and clean, you rinse them underwater, and then you need to make sure that you use the instrument lubricant. So for the lubricant, the dilution on a large scale is 1 gallon per every 6 gallons of water. With the milk, you just put it in there and it can sit for 30 to 60 seconds. And then this you do not rinse off. So once you have them done soaking in the milk, you just kind of pour off any extra. And again, don't rinse them. And then they can just go over on the towel to air dry. Once they're dry, you can either put them directly into a pack to be sterilized, or you can just keep them in a drawer, and when you need them in the future, sterilize them before surgery.